Hi, I'm Wendy and I coordinate cancer research. I'm here to talk to you about MRI scans. The letters M, R, I stand for magnetic resonance imaging. An MRI uses a powerful magnet and radio waves to take detailed pictures inside the body. These images help doctors diagnose cancer, plan treatment, and monitor the progress of treatment. An MRI may sound kind of scary, but the medical team is there every step of the way and will answer any questions. A technologist or nurse will explain the procedure in child-friendly language. Child life specialists may also work with patients and families to help them understand the experience. The MRI machine looks like a big donut with a tunnel in the middle. For the test, the patient lies on a table that slides inside the tunnel. An MRI technologist is there to make sure the patient is comfortable and in the proper position. During the test, the technologist is in the next room operating the scanner and can see, hear, and talk with the patient. When the test starts, radio waves are sent into the patient's body. This process is painless. To make sure the MRI takes a clear picture, it's important to lie very still. Of course, not moving is difficult for children, especially when they are very young. MRIs are very noisy. Some patients say they sound like a construction site or a rocket taking off. Sometimes the MRI makes a funny chirping noise. Then it may sound like a jackhammer or a horn blaring. Often, to block the noise, patients can wear earplugs or noise-reducing earphones while listening to music or watching a movie. MRIs take between 20 and 90 minutes, depending on the number of pictures being taken. To detect certain problems, patients may receive a special dye called contrast to highlight blood vessels and other body parts. Patients should tell the care team about any allergies to prevent a reaction to the dye. Because of the strong magnet, patients should not wear any metal, so it's best to leave jewelry and belts at home and avoid clothing with zippers or metal buttons. Or it may be necessary to change into a hospital gown. Also, it is important to tell the care team about any surgeries or injuries because these may have introduced foreign material into the body. After the MRI, specially trained doctors called radiologists will look at the scans. The patient's oncologist and other members of the care team will see them too. The images help them make decisions about treatment. Patients will have more scans to monitor how well the cancer is responding to treatment. Scans will also occur after treatment to see if the cancer returns. If problems do occur, they can be caught early when they are most treatable. Most patients and families find that MRI scans are one of the easiest and most routine elements of cancer diagnosis, treatment, and follow-up care. Now that you know the basics, continue exploring the site for more in-depth information about scanning or cancer questions. And as always, remember that we are here to help you face pediatric cancer together.